All right, so first we treated your daughter,
Yes, sir.
Allison, and she had a great detox. I remember she was on a lot of methadone,
Yes, she did.
200 milligrams a day, I think.
Actually, it was. She was up to 150 at one point.
150, and
so she's doing well off that.
Yeah, she was a star patient. She really was. And she's still doing well?
Yeah, she's doing well.
We diagnosed some of these other things in her too.
Yes.
And did she have Lyme disease as well?
Yes. Yes.
It's a common cause of addiction. You just came just for wellness, just to try to get healthier?
Yes, sir. And I had some. I thought I had some, chronic fatigue, and thought I had candida, which I do, candidiasis.
Right.
But it's just a minor case.
Right. Which would give you. People throughout the country think that the candida is causing the chronic fatigue, and so did I. And I thought that as well. It is causing chronic fatigue, but it's not nearly as big a factor as some of these more serious things I diagnosed, like Lyme and
Yes.
Bartonella, and the mold toxins. The mold toxicity is much more potent in shutting down your hormones, brain hormones and body hormones. And the chronic fatigue comes from the lack of hormones that actually turn on your adrenaline chemicals. So you had chronic fatigue. How old are you again? I think
I'm 57.
57. Well, you got a great smile now. Well, when you came, your chief complaint was the fatigue and anxiety?
Yeah, I had anxiety, and of course I was concerned about the candida. And so from the test results, they gave me the supplements, which helped a lot with my brain chemistry. They balanced out my hormones, which helped a lot. And the amino acid drips, today was my 9th one, and I'm feeling so much better. I can think more clearly. I feel like I can eat more and digest my food better, and feel more peaceful.
You look happy.
I feel better, and it's really helped me. Just being here 2 weeks has really helped me a lot. So now I'll get the vitamin C IV therapy for the Lyme.
You can do that. That will help kill Lyme, but I use more than that. There are other things in my protocol, but that would be a good start. One of the things, we did the DNA test that I do, and it revealed that you don't make antibodies. You have no antibodies to go grab mold toxins or Lyme toxins.
Yes.
And so your brain would get more toxic, what we call neurotoxicity, earlier and faster than other people. Patients that have Lyme disease who don't have the HLA-DRBQ genetics, they will actually make antibodies to go grab the Lyme toxins. And so a Lyme infection doesn't do near as much damage or suppress their brain hormones and or their thinking nearly as much. And patients who have antibodies, which you don't as well, because you have the double gene or the dreaded gene, they say, you can't make antibodies to mold toxins. Patients that have antibodies to mold toxins can actually work in a building with hidden mold above the ceiling or in the wall and not be taken down so much.
Yeah, I notice if I go in a room and there's like a moldy aircon, I start feeling sick immediately.
Very quickly, yes.
And I have to get out of there. And so this is like great for me to realize I'm not like psycho. This was actual, actual physical
Well, and
thing.
the problem is, as I say in the workshop, the family workshop, and as I recall, you were just all excited and taking notes and things.
I loved it.
I teach in there that the American physicians are so far behind Europeans in recognizing how toxic these mold toxins are. Number one, there's only a few universities who are actually producing decent research. And most of the research I quote on mold toxins is from Germany, from France, from various places. But Dr. Hooper was here a few weeks ago, who actually has the lab in Dallas, closer to you than me since you live in Texas, that measures these toxins. And he said that there were only about 500 doctors in Canada and America even using the testing.
Yes.
So you have a whole country full of people who don't realize that when they walk in those buildings, they're actually getting really toxic very quickly.
It's true.
And
it's true.
So now that we've cleaned out a lot of the toxicity,
I feel better. I mean, I'm not as sensitive. Once you get cleaned out with the amino acid drips, then you walk in a room, maybe there's mold, you're aware of it, but you're not as sensitive because you're cleaned out.
You're so much healthier with less toxins.
Yes.
If you've already got that much toxin load, adding some to it puts you over a threshold,
Yes.
whereas now you're starting from ground zero. Now what we've done in the last 2 weeks or so, we've not only poured out a bunch of mold toxins, we've poured out pesticides that you've taken in for 39 years.
Good. 57 years.
57 years, plus 9 months in a wound, because these toxins cross the placenta. So you've got 55 years and 9 months less pesticides, et cetera, and that's why you feel all this extra energy.
I
Your
feel
brain
so
feels
much
like it
better. I
opened
feel
up.
like I'm maybe 20 years younger or something because, I feel more relaxed. I can digest my food better,
Sure.
more peaceful, sleep better. So I'm happy, and thank you very much
Well,
for
you're welcome.
all the work you put into making this a success. Your
welcome.
treatment program. So thank you very much. I'm very grateful.
I'm watching her, I'm thinking I should just sign up for my own program and use the code.
Yeah.
This is what's supposed to happen. What we accomplished in, 2 weeks or 3?
Only 2 weeks,
2 weeks.
which is amazing.
And unfortunately, we don't have a video when you came. And I think we'll start.
And I was sick the first week because the first hotel I had, I stayed there a couple days trying to endure it, but it was damp and the mold and I couldn't sleep and I was like stressed. So it's amazing that I've recovered as quickly as I have. So
Sure.
So
Well,
thank
so
you
actually
very
we would
much.
sabotage some. My patients, those who have the HLA-DRBQ genetics, if they stay in the wrong hotel, they can actually take in more toxins than I can pull out.
Wow.
And they can actually go backwards. So thank goodness technology got out of there.
Yeah, I got a good one.
But I'm really excited. If you had severe infection processes going on, like some of my patients that you've met here that have come from all over the country for me to kill Lyme, or these other bugs, Bartonella, etc. If you had severe infectious stuff going on, like a lot of the folks, like those blood smears I show,
Yes, sir.
you would not have improved.
I would not have.
We would have taken toxins out, but when we do that, your immune system kicks up to where it should be.
Yes.
In fact, your ability to kill Lyme on your own right now is much better than it was 2 weeks ago.
Okay.
So your Lyme infection
Yeah.
is not as much as others. If it were, you would actually start feeling better the first week. Then your immune system kicks up to where it should go with kill power. Then you start killing these bugs on your own and create more toxic load. See?
Oh.
But you got better every drip.
Yes,
And
I
every-
feel I can
every
think
day.
more clearly, everything. I feel better. I really.
You definitely are bright. I remember what you looked like.
was-
We don't have a before and after picture here for the video
But
because
Dennis took one when I went my
he
first
did, and it's
time.
not here.
But that's all right.
That's okay. And nobody likes everybody to see their before.
I don't.
But it's the before and after that really shows you the difference.
Yeah, I was pale. I noticed when I looked in the mirror, the skin coloring's better. I feel better. I can think more clearly, sleep better, and even
Wow.
like digest my food. So I want to thank you very much. I appreciate it.
Oh, well, you're very welcome. And thank you for doing the video, just to let people know that we can accomplish so much in just a few weeks.
Yes, I really would recommend you. And
The folks back in Texas aren't going to recognize you, are they?
well,
Oh, well. Well, take care, and God
thank you very
bless
much.
you.
Thank you
Take
very
care.
much.